Hello and welcome to another episode of RN Cliff Notes. Thank you for tuning in, okay? All right, so what are we doing? Helping students to see through larger concepts, see through the concepts. And my name is Cliff Davis. I'm a registered nurse, master's prepared, associate dean of nursing, and longtime advanced medical surgical nursing professor. Today, we want to talk about therapeutic drug levels, critical knowledge to know from the perspective of a nurse what your patient's therapeutic drug level should be. All right? Let's just give you a fine example so you understand where we're headed with this. In addition to knowing the actual numbers, knowing the actual symptoms that go with those numbers. Let's take a medication like Dilantin to start with. Dilantin, should your patient receive too much Dilantin, they may start to experience what classical symptom? Can you think of it? If you can think of it, write it down. Okay, that symptom would be, you guessed it, nystagmus, right? So it's interesting that Dilantin is a seizure medication, and at toxic levels of it, right, where they get too much, they start to experience nystagmus. And nystagmus is where a person's eyes oscillate in small circles. And as you're doing your assessment and looking at them, you know to hold your medication, the next dose of Dilantin, because you can already see that they have nystagmus and they didn't have that before in their baseline assessment. So what are we going to do? Let the doctor know and see if they want to proceed with that dose. And the answer would be likely not, right? As they probably already have toxic levels of Dilantin. But here we go. So part 1 of 3. And the medications we want to start with, Digoxin, Lithium, and Desoperamide. Okay? And if you take a look at that therapeutic range, Dig has a therapeutic range of 0.5 or 0.5 to 2. And Lithium, 0.7 to 1.4. And Desoperamide, 2 to 5. Now, let me give you a disclaimer, because depending on what text you're studying out of, you may be looking at different numbers. And by all means, just use this as a reference. And what? Your primary source is your textbook. That is the Bible for the class that you are in. Refer to your textbook. But if you want to use these as a referential guide, that's fine. Okay? First up, our friend Dig, or Digoxin. The first thing is that a digit is a finger. Yeah, your finger is a digit. And some people don't realize that we live in the digital age. And what does that mean? We use our fingers to communicate with these different electronic devices. So we type or text a message in with our fingers, and that makes it digital, right? And we send that to somebody. So, right now, what I want to do is have you take those first 3 letters from Dig and realize we're talking about digits, right? And now, to start with, let's take your hand. And your hand, let's say we took just your palm, and we counted your palm as what? Half of your hand. The other half would be what? Your fingers. So if you look at the actual space that your fingers take up, they take up just as much space as your palm. So, right, your fingers by themselves are what? Half of your hand, right. And what does the medication Dig start with as a range? If we're looking at just the digits, that would be 0.1, 0.2, 0.3, 0.4, or 0.5. 0.5 helps us to remember, right? We're talking about Dig. All right, and if we were looking at the total number of digits on both hands, you already see it, right? Both hands would be what? 2 hands. So starting with just the fingers on hand, right? Just the one hand, 0.5 to 2. And again, if we're just looking at the fingers on one hand, that's not your whole hand. It's just the fingers, which would be 0.5, half of the hand to 2. Study smart, okay? Moving on. Next up, we've got lithium, all right? And lithium its therapeutic range again, 0.7 to 1.4. And we realize that 1.7 doubled, right, or times 2 is 1.4. And what we want to do is realize that the way it shows up on the periodic table, right, as a capital letter L and a small letter I, and just let that soak into your mind here and watch what we do with it, right? Study smart is what we said, yes? So here we go. So let's click on it and let's give it a little bit of a turn. So check out what we're doing. And what happened? If we just look at the red, that Li turned into what? 0.7, which is the beginning of our range. Study smart is what we're after, okay? But now, we also said that if we double it or multiply it times 2, right? Let's take this away and let's do it again, okay? All right, let me get it together here. Okay. All right, good. So check us out, right? So lithium starts off at what? 0.7. And then if we double it, 0.7 plus 0.7, we wind up with what? 1.4. Excellent, excellent, right? We want to know it for good. Okay. Now, on to desylpyramide. So at this time, we want to think about dyes. When we see something that's dye anything means 2. Just like a pair of dice. So the beginning level is what? Dye. 2. Super easy. Now, there's a couple of ways to look at this, but let's go the easy route at this point in time. Okay? So now, if we say disylpyramide, right? Then the other thing to do is to look at this word pyramid. And for those of you familiar with the pyramid shape, and I asked you how many faces does a pyramid have, right? How many faces and corners does a pyramid have? And you want to make sure that you count the base, right? And that total would be 5. 5 faces and 5 corners on a true pyramid, counting all sides. So within this medication's name, it's telling you what its range is. It ranges from 2 to 5. That's found in that specific shape. Yeah? 5 faces and 5 corners. Right? Not bad. Study smart. We want to know term over term for NCLEX and into our professional careers. Yes, absolutely. Okay? Well, ladies and gentlemen, that's the end of part 1. Do find part 2. So thank you for coming, and we'll see you next episode, okay? Take care, guys.